Good morning, everyone. I'm Dr. NIRMALA, Assistant Professor, Department from Department of Pathology. So today's class topic is red cell disorders and anemias. So the overview of class will be mainly under the following headings. First, we'll see a brief introduction on what hematopoiesis actually is. Hematopoiesis is nothing but production of formed elements of blood, that is your RBCs, WBCs, and platelets. So this happens in different sites in different stages of life. So in the prenatal period, that is before birth, it generally happens in the yolk sac initially in the first few weeks of gestation. Later, in the first to second intrauterine life, till 2 weeks after birth, liver and spleen take over. Then from the fourth month of intrauterine life till the birth and after that also bone marrow will be the main active site of hematopoiesis. And after birth, in the children and adults, bone marrow is the main site of production of these blood elements. So, like I said already, in adults and children, there is production of hematopoietic elements in the bone marrow. So, we have different bones, the central bones and the peripheral bones. As the child grows, there is progressive replacement of these bone marrow by fatty elements. In the adults, as we can see, the central skeleton, that is the vertebrae, the sternum, the ribs, the skull, and proximal ends of femur, tibia, and humerus. These are the main sites of hematopoiesis. And even in these hematopoietic areas, about 50% of the marrow consists of fat. So we'll see what are the basic principal steps in hematopoiesis. Initially, we have pluripotent stem cells which convert into multipotent stem cells, which again further uh, convert into committed stem cells, and then they become morphologically recognizable precursor cells, which finally become our mature blood cells. So this is the diagram showing blood stem cells, which can again get divided into either myeloid stem cells or lymphoid stem cells. Myeloid stem cells will give rise to our RBCs, platelets, and myeloblasts, which further divide into granulocytes. That is nothing but eosinophils, neutrophils, and basophils come from this myeloblasts. Whereas lymphoid stem cells, they convert into lymphoblasts, which give rise to B lymphocytes, T lymphocytes, and natural killer cells. So there are different cytokines or growth factors which are required for this process of hematopoiesis. These are called hematopoietic growth factors. So these are nothing but a group of proteins which help in the proliferation, differentiation, and maturation of the hematopoietic stem cells. So, because of the influence of these growth factors, these progenitors get committed to a specific, initially they are pluripotent or multipotent, that is, they can divide into various types of lineages, whereas after the effect of these cytokines, they get committed to a certain specific lineage. So, because of which the function and survival of mature blood cells are also affected. So we'll see what are the different types of hematopoietic growth factors which are present and the sites of production. T lymphocytes produce interleukins 2, 3, 4, 5, 6 and granulocyte monocyte colony stimulating factor. Whereas monocytes produce interleukins 1, 6, granulocyte colony stimulating factor and monocyte colony stimulating factor. Fibroblasts and endothelial cells produce interleukin 6 and granulocyte monocyte colony stimulating factor. Liver and kidney are the main sites of production of erythropoietin and thrombopoietin. For today's class, our erythropoietin is important because we'll be dealing with the mainly erythropoiesis, which is nothing but production of RBC. So erythropoietin is the growth factor which is produced by the kidneys, which acts on the bone marrow and increases the production of the red blood cells. So, circulating blood normally contains three main types of mature blood cells: erythrocytes or RBCs, leukocytes or WBCs, and thrombocytes or platelets. So, the main function of RBCs is oxygen transport, and their lifespan varies from 90 to 120 degrees. These are the cells out of all the three blood cells, erythrocytes have the longest lifespan. WBCs, as we all know, are the defense cells. They help in body defense against infection or tissue injury, and their lifespan varies depending on which type of WBC it is. Like we know, WBCs are of five types: neutrophils, lymphocytes, eosinophils, monocytes, basophils. So depending on which type of cell it is, the lifespan varies. Neutrophils have the short lifespan of 8 to 12 hours. Thrombocytes are platelets, are the other third type of blood cells, which are important for maintaining integrity of blood vessels, and they help in preventing blood loss. And their lifespan is around 8 to 10 days. So today's main topic is anemia. So we'll see how the production of RBCs occur. This process of production of RBCs is called erythropoiesis. It is nothing but production of mature erythrocytes from the precursor cells. This happens in the bone marrow, and the precursor cells mainly are hematopoietic stem cells. And again, like I said, it's this red cell production is influenced by growth factors, hormones, notably erythropoietin, which is produced by the kidney. And this erythropoietin is generally produced in response to anoxia. That is, whenever there is decrease or absence of oxygen, this acts as a stimulus for production of the erythropoietin from the kidneys. And extrarenal production of erythropoietin also occurs in very rare conditions. So what happens? What is the role of erythropoietin? It plays a very important role in differentiating the committed erythroid progenitor cells into proerythroblasts, and its levels are lowered in cases of chronic renal diseases, because kidney is the main site of production of erythropoietin. Whenever kidneys are damaged, then there is decrease in erythropoietin levels, which will lead anemias in such patients. So chronic kidney disease patients will have anemias. Similarly, whenever there is renal cell carcinomas, there is increased production of this erythropoietin, which will lead to increased RBC production called erythrocytosis. Okay. So again, this is the same picture which we have seen here. As we can see, myeloid stem cells are the ones which will differentiate into red blood cells. So coming to the process of erythropoiesis, we have hematopoietic stem cells which further differentiate into progenitor cells, and then they form the colony forming units, and these are acted upon by erythropoietin, which will lead to the production of the proerythroblast. This is the premature blast form of mature RBCs. These proerythroblasts further differentiate into early or basophilic normoblasts, intermediate or polychromatophilic normoblasts, late or orthochromatic normoblasts, reticulocytes, and then finally they become our mature RBCs. So we'll see what is the difference in the morphology. How do we identify these different precursors? So proerythroblasts are the initial stage precursors which have high NC ratio, that is nuclear cytoplasmic ratio. Here we can see that the nucleus is very big compared to this amount of cytoplasm. So there is high NC ratio, and the nuclear chromatin is immature with 1 to 2 nucleoli. And the cytoplasm is basophilic, that is, it is bluish in color. Then it differentiates into next stage is the basophilic or early erythroblast. Here you can see comparatively there is reduction in the size of the cell, but there is high NC ratio, and compared to the proerythroblast, there is slight condensation or maturation of the nuclear chromatin. And here you can see that here there was a nucleolus, but here there is absence of nucleoli. And the cytoplasm here also is basophilic. That's why this is called basophilic erythroblast or the early erythroblast. Then the next stage is the polychromatophilic erythroblast, where the size of the cell further reduces. The nucleus becomes round and more mature with clumped chromatin. Here you can see that chromatin is more dense, and there are no nucleoli, and cytoplasm amount has increased, and it is more grayish in color, because this is cytoplasm is the main site for production of hemoglobin. So as the hemoglobin production starts, there is difference in the color of this cytoplasm. From blue it will turn into a grayish tinge. And this way, because of this basophilic plus hemoglobin is generally pinkish in color. So because of the mixture of these two hues, there is something called polychromatophilic cytoplasm which occurs. And as here from this stage, cell division will cease or stop. Then this gets differentiated into the orthochromic erythroblast. Here further the cell size reduces and it has a pycnotic or very small dense nucleus, and the cytoplasm is well hemoglobinized. So it is more reddish in color compared to the previous stages. And the next stage is the reticulocyte, where there is absence of this nucleus. These are the late erythroblasts or the orthochromatic erythroblasts. They will exude the nucleus, and because of which there is no nucleus in the reticulocyte, but there are some remnants of the DNA and RNA in the cytoplasm, because of which there is mild bluish tinge in the cytoplasm. This is the premature form where there is no nucleus, and this will get into the peripheral circulation and then form the mature RBCs, where the size is further reduced and there is no nucleus, and it has central pallor. That is, there is no hemoglobinization seen in the central part here when you see from above. So the central pallor occupies the middle one third of the normal mature RBC. So these are the different stages. So thing you have to remember is from proerythroblast to mature RBC, the size of the cell reduces. There is a nucleus which is removed in the mature stages, and cytoplasm becomes reddish because of hemoglobinization compared to the earlier stages. This is the same thing which we have seen already. Next, coming to the normal human RBC morphology, it is generally 7.2 micron in diameter with a thickness of 2.4 micron at the periphery and 1 micron in the center. And the shape of the normal mature RBC is biconcave. Because of this shape, it helps the RBCs flex, and it makes it easier for the RBCs to pass through the capillaries. And the lifespan, like we have already discussed, is around 120 days. So this is how a normal RBC will look. When you look at the side view, it is like a dumbbell shaped RBC. And when you see from the above, it is a biconcave shape where the central part is having less amount of hemoglobin, and more amount of hemoglobin is pushed towards the periphery. That's why there is central pallor in the one third of the cell. So RBC has a membrane has trilaminar structure with bimolecular lipid layer interposed between two layers of protein. So there are different types of protein like band 3 protein, glycophorin, spectrin, which are present in the RBC membrane, along with lipids and carbohydrates, which form the skeleton of the erythrocytes. Coming to anemias, we'll see what anemia is. Anemia is defined as reduction of total circulating RBC mass or hemoglobin concentration, or decrease in oxygen carrying capacity of blood below the normal limits that is expected for a healthy person of same age or gender in the same environment. So anemia can either be measured by reduction in hematocrit or reduction in the hemoglobin concentration or decrease in the RBCs. So in general, in India, hemoglobin normally is cut off with anemia is taken as hemoglobin less than 13 gram per deciliter for males and less than 11.5 gram per deciliter for females. So these are the general investigations done in any case of anemia: hemoglobin estimation, peripheral blood examination, red blood cell indices, WBC and platelet count, reticulocyte count, ESR, and bone marrow examination. So these are the different indices which you know of already. So we will see what the normal symptoms of anemia are: tiredness, easy fatigability, generalized muscular weakness, lethargy, headache. These are the normal symptoms or in any case of anemia. As the patient's age increases, that is, as the patients are more older, they have severe symptoms like cardiac failure, angina, or claudication, confusion, depending on the severity of anemia. So again, the symptoms and signs in anemia develop depending on mainly four factors. That is the speed with which the anemia occurs. That is, the more rapid the anemia occurs, the body will not have the time to adjust. So they will have severe symptoms compared to chronic or anemias which develop over a long period of time, because in such cases the body will adjust to the anemia. Severity of anemia: the more severe the anemia, the more symptoms and signs the patient will have. Age: again, the older the patient, the more symptoms they have. And hemoglobin dissociation curve. These are the main things. Signs of anemia: few general signs are common to all types of anemia, like pallor, which is decrease in the pale, which is pallor is nothing but the pale conjunctiva, lower palpebral conjunctiva, and decrease in blood content in the which you can be seen on palms and lower conjunctiva. And then hyperdynamic circulation, tachycardia, symptoms referable to the CNS like giddiness can be seen. Retinal hemorrhages, menstrual disturbances, mild proteinuria, all these can be seen depending on the severity of anemia. Classifications of anemia can be mainly, there can be two classifications. One is morphological classification, the other one is pathophysiological classification. Based on the microscopic appearance of RBC and MCV value, morphologically, RBC anemias can be of three types: normocytic normochromic anemia, microcytic hypochromic anemia, and macrocytic anemia. Normocytic normochromic anemia, RBCs are of normal size, whereas microcytic means there is decrease in the size of the RBC, and in macrocytic anemia there is increase in the size of RBCs. So here in normocytic normochromic anemia, MCV is normal, whereas microcytic hypochromic anemia, MCV is low, and macrocytic anemia, MCV is elevated. So this is what you can see whenever you are seeing on the peripheral smear. RBC size is compared to the nucleus of a small lymphocyte. So whenever the size is similar to that of a nucleus, it is called normocytic normochromic anemia.